Yeah, I can start now, right? Just want to double check.
Oh, Mark, actually not yet. So we're going to go ahead and Dr. Kravitz is going to do our welcome first, and then I'll call on you when it's your turn. So yeah, great.
Okay, well, my clock says 10:31, so I guess I have permission to start. Welcome, everyone. I'm Richard Kravitz. I'm director at UCCS. It's a pleasure to welcome everybody to the second session of our undergraduate policy research showcase. It's a really exciting time for all of us on the UCCS staff because we get to watch and listen to the accomplishments of all the work that you've put in. Take account of everything that you've done and everything that you've learned, and acknowledge your tenacity and sticking with it to the end of the quarter. So we're really proud of you. We also want to express our appreciation to your internship fellows who have made the experiential learning component of UCCS possible. So thank you very much for hosting our students. Obviously, the program wouldn't go on without you. So without any other ado, I guess we'll move right along to our first presenter.
All right, fantastic. So thank you so much, Dr. Kravitz. So the format today will be that each student will present. After the student presents, we'll take one question from their internship host site. If there isn't a question from their internship host site, then we will turn the question over to our academic team. We will have an open Q&A at the end of the session as time permits. And so to start us off, our first student presenter will be Mark Arenas, who interned with the Fair Political Practices Commission, or FPPC.
Hello, and good morning, everybody. I'm going to start really soon. Just need to. All right. Can everybody see that?
Yeah, looks great. Thank you, Mark.
All right, then. Have you ever seen an empty and gated lot as you drive down the street? Well, those are brownfields, and they're defined by the EPA as a property or redevelopment of which may be complicated by the presence of hazardous substances. Brownfields should be remediated because they would increase local tax base, protect the environment, and reallocate community resources. The EPA created a mitigation program offering grants to assist cleanup, but the program has proven difficult to navigate. There is also evidence suggesting environmental injustices occurring at higher rates for disadvantaged communities. I wondered if hazardous sites remediate equitably across all California counties. I hypothesized that as the median household income decreases and the number of non-white residents increases, then the speed at which brownfield sites are cleaned up decreases. My findings show a slight correlation between both of my variables, which I believe should be worth exploring more for the purposes of strengthening brownfield policies. Thank you.
Great, thank you so much, Mark. And if there is a question from our audience or from their internship host site, if you can raise your hand, I can unmute you on my end, and you'll just need to unmute yourself on your end as well. All right, and then if not, going over to the academic team. All right, Sharif.
Hi, Mark. Really interesting presentation. I was wondering what's driving your expectation? So you said there's income and race should have an effect on brownfields. Why is that?
Well, it's a very good question. And during my process of research and data acquisition, I came across several previous studies that suggested that Superfunds, which is a kind of, it was the starting policy that created the Brownfields program, has a similar effect in which you see communities that don't normally have the means or resources to advocate for a more speedy process. Kind of made me wonder and think if it's similar to some of the other programs. So I wanted to look more into brownfields because of that reason. Superfunds are actually pretty well known by the EPA. It's one of their bigger programs, but brownfields not so much. So I just wanted to see if I can dive into anything and find some helpful or useful information.
Great. Thank you so much, Sheree, for the question. And thank you so much, Mark, for a great presentation today.
Yeah.
And so our next student is our Darsh Chandra, and he interned with the Fair Political Practices Commission, or FPPC, this term.
Good morning, everyone. Can everyone see my screen and hear me clear?
Yep, looks great, and we hear you. Thank you.
All right, thank you. For the longest time, California has been plagued by a large incarceration rate that is taking a toll on its criminal justice system. The rates of incarceration are now forcing pretrial release programs in order to alleviate this issue. The question that I'm answering is, how does the cash bail system impact the criminal justice system outcomes for people of color? My hypothesis is that higher bail amounts increase discrimination in sentencing outcomes for people of color when compared to their white counterparts. This was an observational study that utilized a large N study model. The data that I used for this research is sourced from the Bureau of Justice Statistics, released in 2009. The data covers felony incarceration rates in the 75 largest counties in the United States. The independent variable that I have chosen includes race and the percentage of felony defendants awaiting trial. These were measured alongside the following dependent variables, which included percentage of felony defendants, average scheduled bail amount, and average income. I also measured the difference between the average income and the mean bail amounts. The results of my analysis show that African Americans make up 45% of all individuals charged with a drug offense. 20% of these individuals were offered bail in excess of $50,000 or more, and 23% were offered bail in the amounts between $10,000 and $24,999. This hints at a disparity that exists among setting bail amounts based on the ethnic background and the type of crime that a defendant is charged with. The analysis provides support for my hypothesis, and policymakers need to start considering bail reforms that would make it much more equitable. One policy that would help achieve this would be to incorporate a bail system that coincides with an individual's income and savings, as opposed to a scheduled bail system. Policies that allow judges to override bail requirements based on individual circumstances would also allow the pretrial system to be much more equitable. Thank you.
Great. Thank you so much, Darsh, for that great presentation. And so if there is a question from the audience, if you want to just go ahead and raise your hand, I can go ahead and call on you. All right, and then if not, over to our academic team. All right, Ginger.
Hi, Darsh. Great job. And all right, I see in your research methodology that you just looked at 2009, and I was wondering if you could share with us why you just looked at that year in your analysis.
Yes, thank you for the question. So one of the reasons why I chose 2009 is because as I was going through the data sources, I found that for the year 2009, we had the most consistent reporting of the data. And it was, so as I was going through the 75 of the largest counties, right, of those 75 counties, 12 of the counties were from California. And specifically for the year 2009, California, the counties in California that were part of, that were reporting the data had consistently reported their data across the various different types of offenses, as well as the different ethnic backgrounds. So for me, because the data source was available in a much more consistent and accurate manner, I just thought that maybe we should just do a cross-sectional analysis in the year 2009 to sort of look at what's happening. I hope that answers your question.
Great. Thank you so much, Ginger, for the question. And Darsh, thank you for, again, that great presentation today. And so our next student is Nayeli Tran, and she interned this term with the University of California Student Association.
Sorry, I'm not sure why it isn't showing up. I'm having problems sharing my screen with, oh, here it is. Sorry for the delays on internet problems.
And no problem.
Okay, can you guys see the screen perfectly
Yes,
fine?
it looks great. Thank you.
Okay, thank you so much for having me here. Hello, my name is Nayeli Tran, and my research is in equitable access to vaccine in suburban, rural, and urban counties. My research question is, does access to healthcare affect COVID vaccination rates among suburban, rural, and urban counties in California? California's Children's Services Hospitals, better known as CCS, hospitals typically located in communities with no public or secondary inpatient hospital services. My hypothesis is that more CCS approved hospitals per capita results in a higher vaccination rate in these counties. Evidence shows that the number of CCS approved hospitals in suburban, rural, and urban counties show that rural and suburban counties don't have the same access to CCS approved hospitals in their communities. My independent variable is the equity index, and my dependent variable is vaccination rates in California's urban, suburban, and rural counties. I gather vaccination data from California's Department of Health and LA Times from December 2020 to early November 2021. My equity index measures how many hospitals in each county have access to CCS approved hospitals by population. There's a minimal correlation between the equity index and the fully vaccination population. Even though rural communities have less CCS approved hospitals than urban and suburban counties, rural counties have a higher equity index. The implications of urban and rural and suburban counties difference demonstrates how population size appears to be a significant issue and a significant role in how these hospitals are located. A policy suggestion to increase the vaccination rate in these counties, and specifically in rural counties, could be to work with community-based out groups and programs to increase the vaccination rates. Thank you for your time.
Thank you so much, Nayeli, for that great presentation. So I think we have a question from UCSA. So Parshan.
Thank you, and well done, Nayeli. My question for you is, as you were doing your research, and I know that you were working on a lot of different data. It's been a pleasure just seeing how incredibly hard you've been working on this. I'm curious to see if you were able to find any other interesting facts or things that are worthy of mentioning. I know there's a lot of data to work with and too little space on this presentation. So I'm curious to see if there was anything else that stood out to you as you were doing this research.
Thank you so much for your question. Yes, there was a lot of different elements that came into it, but something very interesting that I saw in my data, that overall Latinos and African Americans seem to have lower vaccination rates no matter what county there are, like rural, urban, and suburban counties. So that's something very interesting, yes, looking at that data. And other data, it's as I mentioned before, it's a lot of data. So, but that's the biggest thing that stood out to me, that overall it seems like, exception with Imperial County, it seems like Latinos overall don't have a high enough vaccination rate. Sometimes the non-vaccination rate is actually higher than vaccinated rates in some counties from my data. Thank you for your question.
Yeah, absolutely. That's really interesting. Thanks for letting me know.
Thank you, Parshan, for the question, for hosting Nayeli this term. And thank you, Nayeli, again for a great presentation. And our next student is Matthew Perkey, and he interned this term with the University of California Student Association, or UCSA.
Hello, everyone. So my name is Matthew Perkey, and I'll be presenting my project entitled Capital Counties, which is a county level analysis of California's death penalty. So ever since capital punishment was reinstated in the late 1970s, its use has grown geographically distinct throughout the United States, and especially here in the state of California. Counties like San Francisco refuse to use the punishment, or counties like Los Angeles continually send convicts to state death row facilities. This provides a very interesting question to be analyzed. What are the factors that affect a county's use of capital punishment? I propose that there are 6 main factors: a county's dominant political ideology, whether liberal or conservative, a county's population density, a county's violent crime rate, a county's amount of organized crime, and a county's racial and gender makeup. And from these factors, I also predict that more racially homogeneous, less violent, sparsely populated conservative counties with low amounts of violent crime and low amounts of organized crimes would be the counties that use the death penalty the most. So after combining data from various government and news sources over a 20-year period, 2 geographic visualizations seem to reveal certain trends in county level differences when looking at capital punishment sentencing rates and the severity of the capital crimes convicts were convicted of. As you can see here, notice the differences between the Bay Area, Northern California, and Southern California. However, linear regressions and analysis of variance tests revealed that none of my 6 selected factors were significant linear predictors of these perceived differences. These results indicate that these county level differences are merely caused by the randomness and severity of California's most heinous crimes. While no significant policy suggestions can be made with these findings, this study does highlight the need for the Department of Justice to rethink its reporting on death penalty cases. Not only are reports on death penalty cases hidden in annual reports on homicide, but DOJ data sometimes does not match similar data from the Department of Corrections. This confusing reporting makes it difficult for the public to look at the facts of the California's death penalty and determine its opinion on the punishment.
Great, thank you so much for a great presentation, Matthew. And now we've got a question from Parshan.
Thanks again, Cindy. Matt, it's also been a pleasure having you at UCSA this past quarter. I'm curious. I know that you looked in as you were looking to this data. There were a lot of sort of hopes to find some conclusions and draw some parallels as far as what are some things that we can take. And obviously, your research kind of at least just preliminary showed some inclusive outcomes. My question for you is: do you think that there would be any kind of a different result if we had access to a larger sample, perhaps national data on the same info? And do you know if there is even that kind of data available? And so, just from your own opinion, expert opinion, do you think that we could find some ways to capture any patterns?
Yeah, so that's a great question. So the answer is really kind of twofold. So first off, capital cases are really hard to quantify and do analysis for because they differ very greatly. So compare it to, say theft. You steal this much, it's petty theft, you steal this much. It's theft, you steal this much, it's grand theft, right? As long as you meet the minimum requirements on for a capital case, which is you have to be convicted of a first-degree murder along with a special circumstance, you're going to be given the death penalty. So you have like some small guys, which, they murdered one person, maybe they're a member of a gang, that's a special circumstance, they can be given the death penalty. And then you have kind of bigger guys, the guys that get the nicknames in all the newspapers, Charleston, who killed 11, was convicted of 7 special circumstances. It's very hard to quantify that because they're so different. Also, as seen as my conclusions, it's also very hard because of certain state and federal protections for a private citizen like me to get this data. I looked at 300, during my time period, 390 convicts were sent to San Quentin and the women's death row facility, but I could only find reliable data for 350. So that's 40 people I couldn't find data for. That's about 10%. It could change some of my findings. One of my findings is right on the edge. It's political ideology. So it's about right there. It's not statistically significant, but I think 10% could push it to where it is statistically significant. As for national data, so my report's based off this book called The Decline of the Death Penalty and the Discovery of Innocence. And in the book, they actually compare states. So here's a graph. You really can't see it. But what they found is states usually in the South, so Texas, Alabama, Georgia, they, after the death penalty was reinstated in the late 1970s, they kind of increased their use of the death penalty. And people, policy analysts have said that's because they're super conservative. I think it has something to do with economics, because I know personally that Alabama's police force is not as well funded as California. Some departments use their own personal cars as service vehicles. So maybe they're using that just because they don't have the facilities to house these individuals for a long time. So I think more data will give us a definite answer at the very least, and might move some of the factors I predicted into a statistically significant area.
Fascinating. Thank you, Matt.
Great. Thank you so much, Parshan, for that question, also for hosting Matt this term. And thank you, Matt, for a fantastic presentation today. And so our next student is Daniel Murphy, and he interned with the Local Government Commission.
Matt, if you could please stop sharing. Thank you. Good morning, everybody. Is everyone seeing my screen?
Yeah, looks great, Daniel.
The United States has a long-lasting history when it comes to disparity against minority groups. With the current COVID-19 pandemic affecting minorities disproportionately, as is seen by higher rates of infections, hospitalizations, and deaths compared to whites. This is the same healthcare system which has caused further inequities in other areas, such as financial barriers to healthcare and medical debt for these same minorities. To reach this purpose was to analyze how ethnicity and income affect financial barriers to healthcare and medical debt. My prediction was that higher income levels will cause less individuals to incur financial barriers and fewer individuals to carry medical debt. But the gap between minority ethnic groups and their white counterparts will still be present. My research is sourced from the 2019 Health Reform Monitoring Survey, which was done by the Urban Institute. I did an analysis on the healthcare experience and affordability section of the study and how these answers changed both upon income and ethnicity, and observe any gaps I had come across. I also had applied the same methodology when looking at medical debt. My findings were that the income has an effect on all ethnic groups. The higher income levels had overall lower levels of individuals incurring financial barriers, and the same with medical debt. However, this was seen to have the most significant effect on non-Hispanic whites, whereas this income effect was seen to be smaller on non-Hispanic Blacks and Hispanics. In addition to this, I had found that the same concept had also been applied when looking at medical debt, with this effect being most prevalent at the largest income bracket. There continues to be this measurable gap between minority groups and whites, and although that this gap has been lessened with time, the issue still persists. My policy suggestion would be to create community-based programs that will serve to help these minority groups and to focus on aiding those who are squeezed into the middle income brackets. Thank you.
Great, thank you so much, Daniel. And so, and I see that there is a question from Atlee Keller, and I'll go ahead and unmute you on my side. And
hi there. Thanks, Daniel, for a great presentation. I'm just curious what you would expect to find during and post-COVID pandemic from this data.
This data was gathered pre-COVID, so this data would probably, I would definitely say that this gap would probably increase due to the nature of minorities being disproportionately affected by COVID-19 pandemic. So I would expect that this gap would increase.
Thanks, Daniel.
great, thank you so much, Atlee, for that question, and of course for LGC for hosting him this term. And thank you, Daniel, for a great presentation today. And so our next student up is Catherine Morales Ulloa, and she interned this term with the Los Angeles District Attorney's Office in their Sacramento branch office.
Is it good? Like not
It,
blurry?
it looks great, Catherine.
Okay, thank you. All right. Hello. Okay. Nearly 3 in 5 college students experience housing insecurity within Los Angeles in 2019, leading to my focus. How does the housing crisis in California impact college students from disadvantaged backgrounds? My hypothesis is if more funds were allocated towards housing projects, the rates of housing insecurity would decrease among disadvantaged students. My independent variable is the funds being allocated towards the programs, and my dependent variable being the housing status of students. As the pandemic has unfolded in unpredictable ways, it had left many college students scrambling to make housing plans. Using the survey of the students' basic needs for Los Angeles Community College District, it analyzed over 85,000 students' experiences with unreliable housing in situations within a 12-month range in 2019, resulting to 22% of students reporting they couldn't pay the full amount of rent, 13% stating that they had to move 2 or more times a year, and 20% stating that they had to move in with other people due to financial problems. In total, 35% of students in California reported experiencing housing insecurity. Due to the housing crisis, 46% of the students are worried about covering their cost of tuition and balancing school and work responsibilities, because as these students come from disadvantaged backgrounds, they're most likely having to get part-time jobs as long as attending academics. The Senate Bill 9 was introduced to reduce the housing crisis in California, and the bill would create opportunities for more housing by allowing approvals for housing developments. This would make it easier for schools to be able to build more affordable housing, as well as campuses should be focusing on providing resources aiming towards improving the housing insecurities among the low-income students, such as opening parking lots for students that are living in their cars, or opening facilities like their gyms, like showers, and giving students the resources for the ones that they couldn't attend. That was it. Thank you.
Great. Thank you so much, Catherine, for that great presentation. And if there is a question from the internship host site office. And then if not, over to the academic team. All right, Cherie.
Hi, Catherine. Really interesting project. And I was striking to see that there was a lot of housing insecurity among disadvantaged students. I was wondering, what are some policy solutions that may exist to address some of these issues?
I don't remember on top of my head, but I did have it on my PowerPoint. I think it was Bill AB. I'm sorry, I don't remember the specific bill, but I know that they were trying to pass a specific bill that would ensure that students, especially when you're trying to apply, it said that the community colleges, the UCs and Cal States are required to allow students that are experiencing homelessness to apply onto the schools. And I'm sorry that I don't remember the specific bill name, but I know that was one that they were trying to implement. So the students that are experiencing housing insecurities have a higher chances of attending higher education.
Great, thank you.
Great, thank you so much, Cherie, for that question. And thank you again, Catherine, for that great presentation today. And so our next student is going to be Fernando Rivera, and she interned this term with the California Department of Justice.
Good morning, everyone. Thank you for being here with us today. My name is Fernando Rivera, and today I'd like to discuss my research project regarding campaign contact and its effects on voter turnout, specifically with white and Hispanic voters. And to give some background, I would like to point out that Mobilizing voter turnout has been an initiative that many political scientists have aimed to research for many years, and I specifically was interested in how campaign contact could potentially affect Hispanic voters, given that they are one of the largest minorities in the United States, which also leads me to my research question of, does being contacted increase or decrease propensity to turn out differently based on an individual's race, and if there even is a significant difference? The data that I utilized for my project was retrieved from the Cooperative Congressional Election Study of the 2020 presidential election, where I analyzed my dependent variable of turnout for Hispanics and white individuals, given my independent variable of whether or not they were contacted. I hypothesized that if Hispanic voters are contacted, that their turnout would be higher compared to the turnout of white voters when they are contacted. However, after conducting a regression analysis on my data, it was shown that there was no significant difference, and contact worked similarly well, with an approximate 7% increase for both white and Hispanic voters, as indicated by figures 2 and 3. Overall, contact was equally effective in increasing people's propensity to turn out, regardless of an individual's race. And extending beyond my project, I would be curious to see the role of being contacted by an in-person canvasser of the same race and that targeted voter, and if it could ignite ethnic voting queues, which could potentially increase minority turnout within the United States.
Great. Thank you so much for that great presentation, Fernanda. And so if there is a question from the internship host site office. All right, and then if not, over to our academic team. All right, Professor Quila.
Hey, it's a really interesting project. So, you analyze the 2020 election where we didn't see nearly as much in-person canvassing as we've seen in previous elections. I was wondering how you think that might potentially have affected the findings that you have.
Yeah, thank you for your question. So I did include an implication section. I focused mine more on the effect of the global pandemic, given that we did have a transition to a more virtual environment. So yes, that could have created many inequities in terms of, given people may had to move, maybe people weren't able to be contacted as frequently if they had to go continuously work, if they're like an essential worker. So yes, I do believe that there may have been extra confounding variables within my results. And going further, if there could be a more deeper analysis, that would be definitely something to control for.
Great, thank you.
Great, thank you, Professor Quila, for the question, and thank you, Fernanda, for a great presentation today. And so our next student is Lizbeth Martinez, and she interned this term with the Advancement Project.
Okay, can y'all hear me and see my presentation?
Coming through loud and clear, and the presentation looks great. Thank you.
Thank you. Okay, so again, my name is Lizbeth Martinez, and today I will be speaking on vaccine hesitancy in California, which has been a prominent issue in bringing coronavirus to an end. I asked myself, how have factors such as experiences with healthcare, religion, or politics affected vaccine hesitancy among California residents? Across the state, we have witnessed people asking for religious exemptions because they claim their religion opposes the vaccine. Furthermore, some do not trust healthcare workers or the government. I foresee that if residents are affected by one or more of these factors, then it is most likely that they will display hesitancy in getting the COVID-19 vaccine. To test this hypothesis, I've created an online survey that was answered by 173 Californians through Amazon's Mechanical Turk. In my findings, I found that healthcare did not affect vaccine hesitancy, as the vaccine has expanded its availability to residents without charge. In addition, many residents did believe that religion played an important part in whether they got the vaccine or not. Politics have a heavy influence. According to the survey conducted, about 40% said that they were somewhat more likely to get vaccinated if political officials deemed them safe. It is not a coincidence that the data I collected demonstrates that Democrats were more likely to be vaccinated. In California, Democrat politicians have mobilized to promote vaccination among us, whereas the Republican Party is known to have politicians who have created myths against the vaccine. Among the unvaccinated respondents, there are more Republicans than Democrats. There needs to be a group effort created to create trusted and creative information for unvaccinated folks. Also, policy measures need to explicitly voice consequences since previous California mandates has failed to do so. While the majority of Californians are vaccinated, there's still a 37% that is not. Thank you.
Great, thank you so much, Elizabeth. And so if there is a question from the internship host site office.
Oh, could you keep your slideshow up?
Oh, let me see. Oh, how do I share my screen again?
All right, and then if not, then a question from the academic team. So Professor Quila.
Hi, it's a really interesting presentation. So one of you talk about in your suggestions, mobilizing to create more, trusted information. I guess, one of the issues is the lack of trust in these institutions that are kind of putting out this information. I was wondering if you had any idea of, what could be done to help, increase trust in these institutions that are, coming out with the information that could be helpful for related to vaccines.
I feel like right now a big issue is people who are trying to release this information about the vaccine are not taking into consideration the communication styles people would appreciate, or sometimes people don't understand the heavy jargon. I know in the beginning that's some confusion I kind of had. So I feel like having I know scientists and politicians, they have a heavy influence when it comes to getting vaccinated. So I feel like an important key is that they have to take into consideration how people like to receive their communication, whether right now obviously it's a lot on social media, so then just making sure that they're being targeted with the way they like to receive it, but still making sure that it's factual, real information.
Good, thank you.
Great, thank you, Professor Quila, for the question, and thank you for Elizabeth for the excellent presentation today. And so our next student is Evan Roderick, and he interned this term with the California Business Roundtable.
Hello. I apologize if there is some background noise, unfortunately. As soon as I started, there are workers outside literally shredding wood because of course. Let me know if it's too loud and I'll try to speak over it. So please keep that in mind. I'm probably going to be speaking really loudly into your ears if you're wearing headphones like me. As I'm sure many of you are unfortunately aware, the state of California is experiencing a housing affordability crisis. Home ownership is decreasing, and over half of renters are rent burdened. Inclusionary zoning is one policy tool to make housing more affordable, whereby developers set aside either voluntarily or involuntarily a certain percentage of new construction for people with low income. I hypothesize that metropolitan areas with inclusionary zoning build less housing because developers are discouraged from building if they make less or no return on their investments. I examined the number of authorized building permits as a proxy for construction in 5 of California and Texas's largest metropolitan areas from 2003 to 2019. I gathered data from the Census Bureau's building permit survey and adjusted the permits to the population of each area using Census Bureau population estimates. Each area in California I examined has an inclusionary zoning policy, and each area in Texas does not. I found that the 5 Texas metropolitan areas approved 57% more permits than the 5 metropolitan areas in California. An unpaired t-test yielded a statistically significant p-value of less than 0.0001. This suggests a negative correlation between, a negative correlation between inclusionary zoning and construction. If inclusionary zoning does in fact have a negative effect on construction, Metropolitan areas need to adjust policies to ensure that the opportunity cost of restricting units to people with low income does not discourage developers from building desperately needed housing. Policymakers must make sure these costs are properly offset. Thank you.
Great, thank you so much, Evan, for a great presentation. And if there is a question from the internship host side, if you want to just go ahead and raise your hand. All right, and then if not, over to the academic team. Professor Betters.
Thanks, Cindy. Great job, Evan. I really liked the presentation there. I didn't hear anybody chopping wood, so that's excellent. One of the questions I have is about your second figure there. And we talked about this before, but I didn't realize that the only city that was really kind of comparable to cities in Texas in terms of building was Sacramento. So what do you think, what's so special about Sacramento in terms of building more housing than other places in California?
That is a good question. Unfortunately, there are many variables that were beyond my capacity to account for. Things like the cost of construction, and I was unable to account for differences in the actual zoning policy. That's a really good question. I'm hesitant to speculate. Perhaps it's because I'm not sure how I'm reading the graph 100 gross acres. I'm not sure if many developments are below that, so they would not be subject to a fee. But that's a very good question. Sacramento's an interesting city. I'm not sure.
Okay, yeah, thank you. I assume it has something to do with the space available because the rest of those cities are pretty hemmed in by already built places. But I don't know. It was just surprising to see that that was large. But anyway, thank you so much, Evan.
Sure.
Great, thank you so much, Professor Butters, for the question, and thank you, Evan, again for the great presentation. And so, before we go into the open Q&A portion of today, I'm going to go ahead and just give Sue a chance here to stop our recording